Core Competencies Reference Manual for Medical Licentiates. To Practice in Zambia, Qualification and Responsibilities. Title of the program, Bachelor of Science in Clinical Science. Key accountability for the job. First-line contact with patient in hospital setting. Primary roles and responsibilities. O. Provision of curative and preventive health care services. O. Carry out some hospital administrative roles. O. Refer patient to appropriate level of health care. A person shall not practice as a health practitioner, unless that person is registered as a health practitioner in accordance with the Health Professions Act No. 24 of 2009. In the exercise of its functions under this Act, the Second Council and the Third Council of the Health Professions Council of Zambia instituted licensure examinations to help maintain standards given the emergence of multiple private and public training institutions. This Bulletin of Information on the Core Curricula and Minimum Standards for the Licensing Examinations for Medical Licentiate Practitioner to Work in Zambia binds all parties regulated under this Act. Examination fees for licensure. Examinations, as prescribed by the Council, are payable to the Health Professions Council of Zambia as part of the eligibility to sit licensing examinations. The HPCZ licensing examination assesses a medical licentiate practitioner's ability to apply knowledge, concepts, and principles, and to demonstrate fundamental patient-centered skills that are important in health and disease and that constitute the basis of safe and effective patient care. The HPCZ licensing examination includes, but is not limited to, theoretical and clinical examinations which complement each and the other components. No component is a standalone in the assessment of readiness for medical practice in Zambia. The candidate will be assessed under 3 domains, namely, knowledge, skills, attitude. The above domains will be assessed by means of a theory exam comprising of multiple choice questions followed by a composite objective structured clinical examination, OSCE. The 4 main subject areas assessed under all 3 learning domains for medical licentiate practitioner in Zambia are 1. Internal medicine, 2. Obstetrics and gynecology, 3. Pediatrics and child health, 4. Surgery. Other subject areas prescribed by the curriculum such community health, health systems, management and diagnostics and therapeutics will only be assessed as cognitive domain in the theory paper. The overall expected outcomes of the Clinical Officer General Licensure examination is to ensure that the candidate will meet the minimum expectations for the role as a frontline health worker in the primary health care setting. Core Competency Guidelines. The curriculum must identify attributes in each educational domain, knowledge, skills and attitude, and present them to guide student learning and assessment by examiners. HPCZ directs medical practitioners to be compassionate and empathetic in caring for patients and to be trustworthy and truthful in all their professional dealings. Medical practitioners have a responsibility to respect and provide care that is up to standard for the lives and health that are entrusted by patients. The expectations include medical knowledge, basic and clinical sciences in the management of patients appropriate to their level of care, order and interpret appropriate investigations. Patient care. Obtain a thorough medical history. Develop and carry out patient management plans. Counsel and educate patients and their families. Competently perform medical and surgical procedures considered essential in the area of practice. Demonstrate caring and respectful behaviors when interacting with patients and their families. Provide health care services and education aimed at maintaining health and preventing health problems. Work effectively with other health care professionals to provide patient-centered care. Interpersonal and communication skills. Communicate effectively with the patients, family and health care team. Demonstrate emotional resilience and stability, adaptability, flexibility, and tolerance of ambiguity and anxiety. Accurately and adequately document and record information regarding the care process for medical, legal, quality and financial purposes. Professionalism. Create and sustain a therapeutic and ethically sound relationship with patients. Exhibit culturally sensitive and acceptable behavior when interacting with patients, family and other caregivers. Adhere to ethical, legal and regulatory requirements of the profession. System-based practice. Apply medical information and clinical data systems to provide effective and efficient patient care. Manage and refer patients to appropriate levels of care. Demonstrate understanding of the funding sources and payment systems that provide coverage for patient care. Practice cost-effective health care and resource allocation that does not compromise quality of care. Work in a multidisciplinary team of health care professionals. Use information technology to support patient care. Domain. Knowledge. Domain. Competency. Competency. Statement sub-competencies. Knowledge 1. Medical knowledge. Graduates should be able to apply knowledge about established and evolving biomedical, clinical sciences and application of this knowledge to patient care. Demonstrate knowledge of the normal structure and function of the human body, from molecules to cells, organs and to the whole organism. Apply investigatory and analytic thinking to patient care. Evaluate and recommend changes to investigations. Synthesize and apply knowledge of biomedical sciences. Demonstrate knowledge in medicine, pediatrics, obstetrics, gynecology, surgery and psychiatry. Domain. Skill. Competency. Competency statement sub-competencies. 2. Practice-based learning and improvement. Graduates should be able to investigate and evaluate their patient care practices, appraise and assimilate scientific evidences and improve their patient care practice. Conduct patient care audits. Perform routine patient care technical support. Evaluate and recommend changes-based evidence scientific base. Utilize information technology. Conduct research. Utilize scientific evidence from studies. 3. Interpersonal and communication skills. Graduates must demonstrate interpersonal and communication skills that result in effective information exchange and teaming with patients, families and professional associates. Demonstrate ability in creating a therapeutic relationship with patients. Demonstrate listening skills in a patient encounter. Demonstrate ability in educating patients and family. Demonstrate skills in communicating patient-related findings to colleagues. Evaluate patient and family outcomes to care. 4. Patient care. Graduates must be able to provide patient care that is compassionate, appropriate and effective for the treatment of health problems and the promotion of health. Demonstrate caring and respectful behaviors. Conduct effective consultation, medical interviewing. Taking and recording a comprehensive history. Conducting systematic and accurate physical examinations including mental state examination. Ordering appropriate diagnostic tests and interpret results correctly. Develop and carry out patient management plans. Perform appropriate medical procedures. Perform preventive and promotive health care. Manage different medical conditions effectively. Performing basic surgical skills. Managing appropriate surgical conditions including common surgical emergencies. Demonstrating basic surgical skills in obstetrics and gynecology, including performing surgery independently and managing common obstetric and gynecological emergencies. Carry out clinical practical procedures safely and effectively. Domain. Attitude. Competency. Competency. Statement sub-competencies. 5. Professionalism. Graduates must demonstrate a commitment to carrying out professional responsibilities, adherence to ethical principles, and sensitivity to a diverse patient population. Demonstrate ethically sound practice. Practice informed decision-making. Respect patients' privacy in handling matters. Practice confidentiality with patient information. Demonstrate adherence to code of practice. Demonstrate sensitivity to cultural, age, gender, disability issues. 6. Systems-based practice. Graduates must demonstrate an awareness of and responsiveness to the larger context and system of health care and the ability to effectively call on system resources to provide care that is of optimal value. Demonstrate knowledge of the interaction of their practices with the larger system. Practice cost-effective care. Demonstrate knowledge of management principles in health care management. Advocate for patients within the health care system. Blueprint weights by competencies. S.N. Competency. Weights. 1 medical knowledge 20%. 2 patient care 60%. 3 practice-based learning and improvement 5%. 4 interpersonal and communication skills 5%. 5 professionalism 5%. 6 system-based practice 5%. Core procedures list not exhaustive. The following procedures are the minimum standards and a full list could be found in the curriculum. Common procedures. These procedures cut across all the 4 subject areas mentioned in 4.0. 1. Conduct a relevant history taking in all specific subject areas. 2. Conduct relevant physical examination in all specific subject areas. 3. Interpret specific radiological and sonographic investigation, X-ray, basic, ultrasonography. 4. Perform bedside procedures, vitals, venipuncture, catheterization, NGT insertion, injection administration, etc. 5. Conduct cardiopulmonary resuscitation, CPR, INCL, HBB in pediatrics. 6. Perform basic laboratory procedure, RDT, RPR, HIV, microscopy. 7. Collect specimens and interpret common laboratory investigation, blood, FBC, RFT, LFT, ABGs, etc., urine, urinalysis, MCS, stool, sputum, etc. Internal medicine. 1. Perform lumbar puncture and interpret the results. 2. Drug administration, dose, form and route. 3. Interpret basic ECG. 4. Performs thoracocentesis and abdominocentesis. 5. Oxygen administration. Obstetrics and gynecology. 1. Demonstrates Apgar scoring. 2. Demonstrate the use of a partograph. 3. Conduct vaginal speculum examination, INCL, via Pap smear collection. 4. Repairing of trauma of birth canal. 5. Performing forceps delivery. 6. Conducting vacuum extraction. 7. Conducting assisted breech delivery. 8. Performing caesarean section. 9. Performing removal of retained placenta. 10. Managing uterine rupture. 11. Performing dilatation and curettage. 12. Performing manual vacuum aspiration. 13. Performing manual removal of the products of conception. 14. Performing cervical biopsy. 15. Performing bilateral tubal ligature. 16. Performing laparotomy, e.g. ruptured ectopic pregnancy. 17. Managing a vaginal delivery. Pediatrics and child health. 1. Conduct support ventilation, ambu bag. 2. Interpret lumbar puncture. 3. Implement EPI. 4. Managing nebulizing. 5. Referral procedures. Surgery. 1. Perform Heimlich maneuver, abdominal thrust. 2. Immobilizing pop, splinting, arm sling, etc. 9. Performing skin suturing. 10. Performing excision. 11. Performing appendectomy. 12. Performing amputation. 13. Anesthesia local, regional, general, dissociative using ketamine. Public health. 1. Identify, plan and implement health promotion activities. 2. Formulate a research proposal and conduct simple research in a community. 3. Conduct community diagnosis. 4. Conduct school health services. Reference materials. This list is not exhaustive and a full list can be obtained from the curriculum. Biomedical basis of disease. Tortora J. Derrickson B. 2014, Principles of Anatomy and Physiology 14th ed. Hoboken, N.J., John Wiley & Sons. Prescott, et al. 2011, Microbiology 7th ed. New York, McGraw-Hill. Murray K.R., Botham K.M. 2012, Harper's Illustrated Biochemistry. 29th ed. New York, McGraw-Hill. American Academy of Orthopedic Surgeons 2013, Emergency Care and Transportation of the Sick and Injured. Orange Book Series, USA. Bennett P.N., Brown M.J., Sharma P. 2012, Clinical Pharmacology. 11th ed., Churchill Livingstone, London. Robbins Basic Pathology, 8th edition. Saunders Elsevier, 2007. USA. The McGraw-Hill Companies Inc. Internal Medicine. Edwards C. Monroe J.F. Brocher I. 2010, Davidson's Principles and Practice of Medicine 21st ed. Edinburgh. Churchill Livingstone. Kumar, P. and Clark, M. 2005. Kumar and Clark's Clinical Medicine, 6th ed. London. Elsevier Saunders. Obstetrics and Gynecology. Manga A. Dobbs S. 2006, Gynecology by 10 Teachers 18th edition. London. Hodder Arnold. Malcolm, S. Ian M. Simmons 2006, Essential Obstetrics and Gynecology 4th edition. Edinburgh. Churchill Livingstone. Please note that there are newer editions of above-mentioned books. Hence, use the newer versions. Pediatrics and Child Health. Mark Dant K. et al. 2011, Nelson Essentials of Pediatrics 6th ed. Philadelphia. Saunders Elsevier. Goldblum R.B. 1992, Pediatric Clinical Skills. London, Churchill Livingstone. Surgery. Rains H. Ritchie D. 2003, Bailey, Hamilton, Bailey and Loves Short. Practice of Surgery 26th ed. London, H. K. Lewis. Bott, S. R. 2012. SRB's Manual of Surgery, 4th ed. J.P. Brothers Medical Publishers, Inc. Psychiatry Gelder M. Mayu R. Harrison P. Cowan P. 2005. Oxford. Textbook of Psychiatry. Oxford. Oxford University. American Psychiatric Association. 2000. Diagnostic and Statistical Manual of Mental Disorders, New 5th ed. Washington, D.C. American Psychiatric Association Press. Public Health. Mackenzie J. Pinger R. 2011, Introduction to Community Health. 7th ed. Burkington, M.A., Jones and Bartlett Learning. Cothery C.R. 2004, Research Methodology Methods and Techniques. New Delhi. New Age International P. Limited Publishers. Interpersonal and Communication Skills. Guffey M.E. 2007, Essentials of Business Communication 7th ed. Australia. Southwestern College Publishing. Hybels S. Weaver R. 2004, Communicating Effectively. 7th ed. New York. McGraw-Hill. Professionalism HPCZ. 2016, Guidelines for Good Practice in the Healthcare Profession. Maintaining Patient Confidentiality. HPCZ Lusaka. HPCZ 2016, Guidelines for Good Practice in the Healthcare Profession. Generation and Management of Patient Records. HPCZ Lusaka. HPCZ 2014, Professional Code of Ethics and Discipline, Fitness to Practice. HPCZ Lusaka. HPCZ 2016, Patients' Rights and Responsibilities. HPCZ Bulletin. Lusaka. Banda S.B. Healthcare Ethics and Professionalism Course. https://virtualcityacademy.com/ System-Based Practice. Cole A. 2002, Personnel and Human Resource Management. London. Book Power. Handy CB 2000, Understanding Organizations. Oxford. Oxford University Press. Thank you for watching. Please subscribe and comment. For more, check out the new logbook.